Why should he even tell us that if you are a nurse and you want to if a womanizer?
It is not good.
No.
That one day I have a lot to say.
So tomorrow, because we are going to say it exactly. Hey, my God has disappointed me.
Okay, let's go.
Hi guys, welcome to another intriguing episode of the Theextraonurse.m midwife show. You all know what time is it when I'm out of the studio. Drum rolls, please. The Theextraonurse.m midwife show, the street vibe edition. On today's episode, we are naming it the no filter edition, where we'll say it exactly as it is. So tag along and let's meet some amazing nurses. As always, my name is Na Momo Tete, but you can always call me number man when you see me on the other side. Let's go, guys. Hi, star player, superstar. Hi, Sammy.
Hi, Na Momo.
Are you the Betty Pele of our time or the JJ Okocha of our time?
I might be Sergio Ramos because once I'm a defender.
Anyway, guys, so tell me something. What makes you an extraordinary nurse?
So what makes me an extraordinary nurse is my ability to make critical decisions under high pressures. When some cases comes and then you want to make a critical decision, my ability to come out with a sharp idea to deal with that situation. And then also sometimes my patient will come and then looking at the person's condition, the person will be like, there's no hope. And then my ability to explain things to him or her and then give him or her a chance or a hope, that makes him an extraordinary. Yeah.
Thank you. Oh my God, guys, I'm so privileged to have my extraordinary nurse manager here today with me on the show. Hi. Thank you, sister. Her name is Mrs. Sandra Inseju, extraordinary nurse manager from St. Number. Thank you, sister. We are so happy to have you on the show. So, Ima, tell me what you won't tolerate from your fellow nurse.
My colleague nurse who usually come to work very late. That's one of the points that I won't tolerate from my fellow nurse. And then a colleague nurse committing wrong, and then you would want to correct that nurse in front of patients. I think that one too is something that you also need to take a look at it, and I want to tolerate that.
Yeah. I think Ima has like valid points. Anyway, what I won't tolerate from my fellow nurse is the fact that we can't have a good teamwork relationship. You can't come to work and be like, you have issues with blah, blah. No. Once we are at work, it's a teamwork situation, and that I would not tolerate. No teamwork, no namuba money. So, mami, my ending come on. Catch me as me, your colleague, right? Then na me ya umpe ewe jumemu. Like you won't tolerate our work.
At work. Okay. May that's for a question. Nah, in fact, enema baby.
Also.
Ebine say, me fan say, ye nyina ya ba adwuma. Fine, late the ye nyina ye bi, but a continue a ha adwen. Aside no, a doctor aba wabo plan. Oh, say be a patient, also you could try an X-ray, also you could try scan and answer medication be or a hoodie be. Instead, say be a next a shift bebano. Also, cast be a patient is saying says and I be a doctor no more plans and them, but waka or the nanwaka. It's about afternoon. Also, my way. Even though say be with demo, sometimes service to me to call. To me share system so but catch any partner. But it be more hormone for
They won't tell you.
They won't tell you. But in the next morning, be a one beba morning.
Yeah,
Then have doctor no on no.
Exactly.
And obi on why you don't have to say you monitor for BP or RBS. Over banana patients no or more monitor. Itu baba no de bia wanna pressure be so
And
so
it's still
and you're
so.
fine. And you're fine.
All right, so
Seriously.
thank you. Anyway, this is Sofumami of Surgeon of God Hospital. I think she's hammering more on our clinical practice, and I so agree with her. One thing again that I won't tolerate is nurses who snitch. Are you guys following us? Yes. On YouTube, TikTok, Instagram, Facebook, Thread, what other social medias? Hi, in charge.
Hi.
Anyway, so I want to ask you something. What won't you tolerate from your fellow nurse, like a fellow colleague?
What I'll not tolerate from a fellow colleague is a colleague shouting at me. I will never tolerate it. At least speak calmly to me. If it's even a mistake that I've done, at least correct me calmly, but don't shout at me.
That's nice.
What I won't tolerate from a colleague is disgracing you in front of patient's relative. I will never and ever tolerate it.
Period. Per. Anyway, what's your name, darling?
Ernestine, say your what?
Hey, welcome.
Okay, so what makes me an extraordinary nurse is that my expertise and skills are top notch.
Period, girl. Period. We have some amazing nurses in the most prestigious and prestigious hospital. So anyway, I'm surprised why my director is not asking me what makes me a whole me an extraordinary nurse. Anyway, so like my colleague said earlier, my expertise and skills are top notch. And the fact that I can just juggle in between slaying and being a nurse at the same time. I don't know if that's extraordinary, but yeah, I can be slaying and sweating and working at the same time.
Okay. So I am an extraordinary nurse because I am enthusiastic, professional, and also make sure I render the best and safe medical care for my patients. I also advocate for my patients as well. So that makes me an extraordinary nurse.
Thank you, in charge. Hi, Enoch.
Hi, sister.
Tell me exactly what makes you an extraordinary nurse.
Okay. Being an extraordinary nurse is one of my capabilities in being an extraordinary nurse. I'm very empathetic in terms of if patient needs something to continue his care, and if I have the available resource that I can use to provide to her or him, I'm willing to do so. So I think that makes me an extraordinary nurse.
Thank you. Hi, darling.
Hi.
What's your name?
Daisy.
Hey, Daisy. Where is Lotus and Lily? And anyway, Daisy, nice to have you here.
Thank you.
Okay, so tell me one thing. What makes you an extraordinary nurse?
Oh, okay. I'm very punctual at work.
Yeesh.
I come to work very early. And when I come to work too, I do the necessary thing.
All right. Thank you.
Thank you.
We can't wait to have you when you when you complete. Thank you, Daisy. Dad, tell me something. What won't you tolerate from me as a colleague? What won't you tolerate from your fellow nurse?
Like gossiping about me and disgracing me in front of the patient.
Yeah. I think so too. Anyway, thank you.
You are welcome.
What I will never tolerate from my fellow nurse. Number one, disrespect. Number two, a laziness. Number three, a sycophant. Number four, number four.
Hello, Faye.
Unprofessionalism, filthy, a whole lot, but we will figure. Yes, womanizing.
Next day, fill me in. What would you tolerate from your fellow colleague?
Okay. So ideally, There are a lot of things, but the first thing I also talk about is disrespect. And secondly, maybe we are all born to make mistakes, but I won't tolerate my fellow nurse to correct me in the midst of a patient and a relatives. For that one also, I'll have a lot of issues to deal with. So I think these are the two main things I will talk about for now. Yeah.
Hi.
Hello.
Hi.
Hello.
Please tell me something. Tell me something. We work with ourselves. Tell me
Yeah.
something. What would you tolerate from your fellow colleague?
Well, backbiting.
People who talk behind your back, I don't really like that at all. That's the only thing I'm going to say.
And one more thing, me, if you leave me, I'm the only person who says stuff. Oh, one more thing, I hate people who break their communication chain. Like, if we have a problem on the ward, go through the correct communication channel. You can't just, like I said,
Yeah.
snitch on me and get straight to the nurse manager without talking to the appropriate people.
Exactly.
So, nurses, use the right communication channel. Oh. Alright guys, so we are currently at the most prestigious maternity in Western North region and beyond. I want you guys to come with me so we speak to some amazing midwives that we have here. You guys understand the drill, right? So tag along and let's go.
All right. Let me say when there is a baby out, and as a midwives, we all have to come together and just help the baby to breathe. And you will be standing idle without helping. And that one I will not tolerate it.
So you see the teamwork I spoke about?
What I don't really like about my colleagues, I don't even have, I don't actually have problem with my colleagues, but rather the students and then the rotation nurses. When a patient comes to deliver and then you see the person is in pain and actually you don't take it serious and then you've been playing about whatever you have to do for the client, you don't do it early, fast, and then you don't show any concern about the pregnant mother. I don't really like that.
Thank you very much, extraordinary midwife. Yeah. So I'm kind of a bit intrigued about today's episode because the midwives are giving me all the bars that I need to hear. So I want to ask this particular extraordinary midwife, the exact same question. Sweetheart, what won't you tolerate from your fellow colleague?
What I won't tolerate is when my fellow colleague wants to like overcome you in everything. Let's say you people are taking care of a patient and then you will need ideas. That's why in our I think nursing ethics we have something called teamwork. So we work as a team, and in such cases when there is an emergency, we all need to share ideas. But in a situation where a colleague or detach him or herself to like ignore the patient and then leave everything to you to work on the patient, it makes it the
You
work
hate
of
it,
the-
eh?
Yeah,
Anyway, thank you very much. What's your name?
I'm Doris then too.
Thank you very much, Dor. Mando. My mom is Doris too.
Oh, okay.
Thank you. So I want to ask Doris, what makes her an extraordinary midwife?
Okay, when it comes to me, my patients, their healthcare is my priority. So, in a scale of preference, I'll put them on top.
Thank you, Doris. I like it when nurses look different whilst on the job. So I have here with me China to tell me why he is an extraordinary nurse.
Okay, I'm at the maternity ward, specifically labor ward. Extraordinariness. Being an extraordinary person means doing something, like, let me say, putting yourself in the patient's shoes. So caring for the patient extraordinary, like you care for the patient in a different way from maybe the way your other colleagues they care for their patient. That makes you an extraordinary nurse.
Thank you, China. Maybe we'll meet Techie very soon, but we just spoke to China on how he is an extraordinary nurse. So if you get to my facility and you're looking for one extraordinary midwife, it is Yvette. So here with me on the show, I want to know why she is 3 extras of a midwife. Tell me why you are an extraordinary midwife.
Because I am unique.
My name is Emma. I'm a midwife at St. John of God Hospital. I want to relate disrespect and lack of accountability from my colleagues.
All right, thank you.
Hi, I'm midwife Patience. What I wouldn't tolerate from my fellow colleague is absenteeism without prior notice. And what makes me an extraordinary midwife is punctuality, hard working overtime, and also I'm the type of midwife that some of the doctors call when there is an emergency and needed a midwife to be an assistant. Thank you.
Hey, are you getting paid for that?
I'm Davidson Mary, a midwife at St. John of God Hospital.
Okay.
And what I really like about my job is I really like babies, when they come to earth, they start crying. So as a midwife, what should I do? Immediately, I make sure my baby cries. I do my birth preparedness, the birth preparation area, and everything that will help with baby resuscitation. So every day, that is my job, that is what I earn, that is what I do. Educate even my clients, even before they come to the delivery room, because that's the place that we are going to get these babies alive. So immediately when they come, I try to resuscitate, make sure my baby cries, make them comfortable and warm, and put them to breast. That is my main aim. And secondly too, with my colleagues midwife, really I like motivation. I like them to bring the best out of their lives, because there are a lot that they can do. People will just think that maybe what they are doing, they can do it outside, they can do it even better than that. Even we are in a remote area, but the work that we are doing here is even much better than those in the urban cities. So I really like to encourage them to bring the best, so that they all know that midwives we can do better without even a doctor. We can do everything exceedingly. That is our main priority here, because with the health delivery excellence, we want to bring that one into practice. We want to achieve that one. So every day we encourage ourselves through presentations, through various meetings that we have. Sometimes we talk about ourselves, move on about anything that is challenging in this life or pertaining to our work. So every day that is what we do to boost our morale. And thirdly, with our clients, we have so many people that have problems, challenges that we need to tackle. So health education is the main factor. Each morning, I try going around the wards, trying to tell them what to do to prevent infections and all that. So with that, it makes the client too happy that since I came to this hospital, I've been hearing a lot about how to care for my babies, how to take care of myself, and many others. So they feel happy. Next time, they all try to come to the ANC when they are pregnant or delivery. They all try to come to the hospital to deliver, not staying at home and coming with many other complications. So my clients do well to also make happy and also have good and excellent babies. Thank you very much.
So there you have it, on the unfiltered episode of the Theextraonurse.m Midwife Show. Did you hear them? Anyway, if you couldn't join in on the discussion, you can leave a comment under our social media handles. You can like, follow, subscribe, comment on all our social media platforms. As always, my name is Na Momo 30, but you can call me Namoba Man when you see me on the other side. And as always, like I always say, work is work. You are you, so always be extraordinary. Bye.